point to patients who've perhaps suffered some significant event in their lives, like having a heart attack, or even knowing somebody who's had a heart attack, who then present to a doctor's surgery and wanting to change things, wanting to take a different direction with their health or their lives more generally. And seeing a health trainer and getting some ideas and getting started and getting encouraged, and then a little bit of follow-up, not necessarily long-term, but a starting point and a bit of a push in the right direction, if you like, can make a real difference to people.
We give that client that hour session which they can spend how they wish. We're not rushing them, so they're able to think more clearly, analysing themselves, so we're able to give them encouragement to just express themselves a bit more freely than a GP or nurse might be able to.
It is useful because they might tell you something you either don't remember or you don't know. I suffered a heart attack and I had a bypass recently in December. So I was keeping away from greasy things and more spicy things and things like that, but I did not really knew about the cake and biscuit, that they harm you so much. So this is the difference now. They are persistent, that you keep away from these things which you need.
The difference is that the people feel that they've been listened to, they've been given the time, they've been listened to with a person who lives maybe next door. I will say in a sentence which will explain it. It's a help from next door, not from top down.
It involves a lot of things. It involves putting together a personal health plan for them, finding out the right services to signpost people to, for them to being able to achieve the outcomes that they want to achieve through the goal setting.
We've tried to develop the Health Walk programme because it gives a really good access into exercise and a healthy lifestyle because it's low impact. We do gentle local walks and it's a really good first step for someone becoming more active and healthier.
The reason I come on these walks is because I meet a lot of nice people. We can all chat together.
Well, it's social, it's exercise, a bit of banter. Everybody takes Mickey out and everybody else.
Plus, it's good for my health because I suffer from angina and I have bad legs as well.
So apart from being blind, I have trouble with my balance as well. I won't get 10 yards without falling down, I don't think, unless I've got something to hold on to. It supports me physically, you know. He gets a grip on me and he's holding me up most of the time, you know. So it's essential for me.
It's just like to try giving them as much support as we can.
It's not just physically healthy, I think it's mentally healthy as well. You know, to be with other people.
Well, if I didn't come on these, I wouldn't get out at all for 1 week into night. I've only my daughter, and she don't live with me. She takes me shopping every Saturday. And before I started with these, I never got out at all.
I'm usually a guy who changes jobs all the time, but I've really stuck to this job for 10, 11 years because I know the benefits, I can see the benefits for the people. And of course, with myself, I feel happy with myself helping others.
In terms of people who've benefited from the programme, according to the figures that we've got, it's around about 11,000 people. Now that sounds like an awful lot, and there's bound to be a little bit of duplication where two health champions might have worked with the same family. But nevertheless, we know we've made an impact on a very large number of people's lives.